So from June the 8th, we move into phase 2 of the government roadmap to reopen society and businesses. The Health Protection Surveillance Centre has updated their guidance, which is available online to support those who are cocooning and their families. While it's not possible to eliminate all risk, everyone should exercise their own judgment with regarding to the extent to which the cocooning guidance applies to themselves. If you do choose to go outside for exercise, for example, you should strictly adhere to the 2-metre physical distancing, avoid touching people or surfaces, and wash your hands on your return home. If you go driving, stay within the 20-kilometre distance and do not go with anyone who's not cocooning with you. If possible, avoid public transport or at least use it off-peak where a physical distance of 2 metres can be maintained. Use face coverings on public transport and if you choose to go shopping. Avoid group gatherings if possible, or if you are meeting, preferably meet in small groups and outside. Work from home if this option continues to be available to you. If you have someone else living with you who does not fit the criteria for cocooning, for example, family members, they are not required to adopt these protective measures themselves. They should stringently, however, follow the guidance on physical distancing, reducing their contact outside the home, wash their hands thoroughly and regularly, especially if they arrive home, and observe good respiratory hygiene at all times. All these advice measures are available on government.ie. With regards to the particular medication this lady is asking about, initially the Association of British Neurologists guidance classified the oral and IV immune reconstitution therapies as a high risk to people with MS during the COVID-19 pandemic. However, this has been further examined in the latest version of the ABN guidance, which was updated on the 19th of May, and the oral immune reconstitution therapy has now been classified as intermediate risk as a disease-modifying therapy. Therefore, as the pandemic continues, the advice is that people with highly active MS who were about to start, for example, the oral immune reconstitution therapy, or who may have been due their second year of treatment, which was delayed due to the risk of COVID-19, they should have their treatment available to them, or at least have it planned now. I'm not sure where this lady is with regards to her treatment cycle. For example, have you had your treatment prior to the start of the pandemic? And if so, we're almost 3 months later, so your first bloods would be due. This would give an indication as to where your lymphocyte count is and the potential risk for viral infections. So you could check with your team that in fact, do you need to continue to cocoon now? Or if it's your second year cycle, in the phase 3 trial program, about a quarter of patients had a transient grade 3 or grade 4 lymphopenia, which tended to occur after the second course in year 2, when subjects were redosed despite their lymphocytes not yet recovering from year 1 to above 0.8. So if you're awaiting treatment at this point, you will have to check in with your team with regards to advice about further cocooning. Interesting, Professor Gavin Giovannoni has examined in detail the effect of this oral immune reconstitution therapy on the immune system and on lymphocyte depletion. He doesn't consider it necessary to shield or cocoon during the current pandemic. He says maintaining social distancing and practicing good personal hygiene and to avoid potentially infectious people is protection enough. Though he does state if you're working in a high-risk group or in frontline, such as healthcare professionals or those with direct patient contact, they should have non-patient activities until their lymphocyte counts are greater than 0.5 in those that are less than 60 years old, or greater than 0.8 if you're older than 60 years old.